Welcome back, guys, to another episode of Hormones Happen. I'm your host, Jeremiah, also known as the Optimized NP on TikTok, and I have a special guest with us today. He's a physician assistant, health coach, and the owner of the Colorado Springs Health Collective. Logan, thanks for being with us, brother.
Absolutely. Thank you for having me.
Yeah, sure, man. I'm really glad to have you on. Tell us a little bit about your background and what led you to the direct primary care model.
Yeah, so I've been in practice for going on 9 years this year. Started off in orthopedics, switched to emergency medicine for most of my career, and then went into mobile urgent care, which I saw a huge amount of value in that for the patient population out there. Finally landed on internal medicine, did that for about 2 years, and absolutely enjoyed the deep dive that I get to do with those types of patients, really get into the root cause of what they're coming in for. But ultimately, we decided to start a direct primary care practice because we saw this issue with the current insurance model in which they're kind of driving the care across the board. They're dictating what we can and cannot do. And then at the end of the day, within most of these models, it's all revenue based. You're forced to see more and more patients and spend less and less time with them. And when it comes down to being a provider and seeing your patients, you want the best thing for them. And it's not our choice that we have to be forced to cut down on how much time we get to spend with you.
Yeah, that's very, very true. When did you first hear about DPC? When was that kind of first on your radar?
Actually, my wife heard about it when she was in nurse practitioner school. She's been a nurse practitioner for about, I want to say 5 years now. And we started doing a little bit more research into it and found the model to be extremely beneficial. I thought about it for probably about 2 years more seriously. And then I finally jumped ship and went full force.
All right. When you first heard it, like, what did you think? Did you think, like, is this even legal? Like, how does this even work? What were your thoughts?
Yeah, definitely was a little bit of a learning curve in regards to, how to give patients value with paying cash for something that a lot of people think that you need insurance for. But then seeing how a membership can give you so much more time and access, removing the middleman, the billers, the insurance, the reimbursement arguments, everything like that really just lowers the overall cost of healthcare and allows us to bring it at a lower cost to our consumers, which I thought was super valuable. And then what really set it off was when I went to my primary care doctor, I had a high deductible plan. I was
Mhm.
supposed to have my preventative care visit completely covered by my high deductible plan. And I'd never seen the provider before. So I went ahead and told him, hey, I have chronic knee pain and I have psoriasis. And he took that like a good practitioner should and said, hey, like, let's dive into this a little bit and, figure out if they're correlated. Sure enough, it went from a preventative visit to a diagnostic visit, ended up with a $700 bill when it was supposed to be completely free.
Yeah, if you've never paid $700 for a simple 4-view X-ray of a knee after insurance, it's painful. And you
Yeah.
learn, dude. It's like touching the stove. You do it once and you learn. And a lot of people think like, well, why would I want to pay cash for my health care when I have insurance? But you hit the nail on the head. We're talking lower cost, higher value. What people don't understand, and we're getting a lot better at, this stuff is not nearly as expensive as we think it is. There's such a markup when we go through insurance, not to mention the barriers to being able to select and have a say in our healthcare. Now, you've been in the hospital quite a bit. What would you say some of the biggest barriers that you've seen insurance cause for that individualized care?
Yeah. A lot of times you need the proper diagnosis codes to even be allowed to do anything, order different images, order labs. And then if you don't have the right diagnosis codes, it ends up either being rejected or not covered. Prior authorizations, like if you have chronic knee pain and you want to get an MRI of that knee, really figure out what's going on. A lot of times they make you do physical therapy first instead of just getting to the answer right away. And then I think that within the hospital, especially different consults for different specialties, every time you consult a new specialist or the primary care team for something easy, that's driving up the cost for the patient. And they're not really even recognizing that that's a thing. So we're driving up the cost for our patients. They're ending up with the bill. The insurance looks like they're covering a huge portion of it because the price has been marked up so high. But in reality, like you just mentioned with the x-rays, I went in for an x-ray of my ankle one time, $250 for an X-ray with insurance, and I'm like, all right, I'm going to use cash, and they're like, okay,
Yep,
cool, 65
70
bucks.
bucks. Yeah, it's crazy. It's just
Yep.
absolutely nuts, but this isn't something that we're told, right? We're told from the get-go, like, "Hey, you have health insurance. Anytime you get sick, injured, this is what you use." No one's ever told us, "Hey, there are other options." And I mean, not only does it save you money, but, let's not forget the fact that when you go to your traditional insurance-based primary care clinic, these are 10, 15-minute appointments if you're lucky. What can you really flesh out in 10, 15-minute appointments? When you're going to a DPC practice, what are your average times?
Oh, we usually aim for about an hour, especially with a intake appointment. We really want to get to know our patients, what's driving their health. I read a whole book on just being a happier person makes you healthier, mainly because you're not leaning into junk food and unhealthy habits to kind of cope with that. So really diving into their mental health and seeing what's causing them anxiety, what's stressing them out, how can we address that, and then just really listening to them and seeing what their lifestyle looks like. Everyone's life is different. If you take a 25-year-old with no kids, it's going to be easier than
Yep.
a 35-year-old with four kids.
No, yeah, sure.
So big variances there, but I think in the insurance model, everyone gets treated very similar because they don't have that time to form a relationship with their provider. They don't have time to give you the preferences that they want their healthcare to look like. And that's something that we love to dive into with all of our patients and really listen to them and um, see what they want to do. If they want to lean into lifestyle changes or if they just want a medication, we're here to support you either way. But certainly push for one or the other.
And see, that is true medicine because you're able to actually practice to the extent of your license. Whereas, and this is the thing too, a common misconception is like, oh man, my provider sucks. No, that's not the case. You got to believe it. Like when I was in primary care, we don't have a say. You got to do what insurance wants. You get these decision making trees, you get all of these steps that you have to take in order to get simple things approved. So it's really, you're not even practicing medicine, to be completely honest. You're just going down these algorithms, going through all the steps that need to happen for the end goal that you know needs to happen. Whereas now, guess what? We can actually have a joint decision making process, right? We say that all the time, joint decision making process. But when you're actually being dictated by insurance, that can never happen. It's usually just dictation. But the joint decision making process is important because if the person you're talking to, that patient truly believes that you care, they know that you care, they're going to listen to you. No one cares what you know unless they know you care. And that's the first step is developing that relationship. Can't do it in 10, 15 minutes. An hour? Oh my God, that's more than enough time. That's plenty of time. And some people just need some reassurance. You'd be surprised how many people need to just talk, right? They don't need something. They don't need a medication. They don't need a script. They don't need intervention. They just need to talk and they need someone to listen. So, what kind of services do you offer?
Yeah, so we primarily do mobile primary care right now. The way it really works is we come do the intake appointments. If you have a blood pressure machine, we make sure that corresponds with a manual blood pressure so that if we are trying to, treat your blood pressure moving forward, start you on a medication, you don't necessarily have to be seen by us again if we want to make a phone call and say, hey, my blood pressure's been running high over the past couple of weeks. I don't think this med is working. We can adjust that over the phone, really to save you and I time. So I think that's pretty cool. And then we're offering mobile IV therapy,
Cool.
vitamins, migraine cocktails. I think that, nausea meds, that was a huge thing with the mobile urgent care that I did that people absolutely loved, used it all the time. Um, we're offering health coaching, which I think is, something that isn't typically offered within primary care, but is just so well correlated. I believe that, muscle is medicine. And like we talked about earlier, mental health, stress, sleep is just paramount and everything. So just combining all of that and looking at the basics, which really get you further than a lot of medications even, is super important. So that's something that if we want to spend more time on, Meet Weekly, something we're offering there. And then I'm drawing a blank. I think those are the main ones,
Cool.
the ones I'm most excited about. Yeah.
Yeah, dude. I mean, the health coaching, that's a first, dude. I have not talked to any practitioners that do any kind of health coaching. Now, there's so much to that, right? Like I personally, I wake up in the morning. I get up right now about 2:15 in the morning, get up, I'm at the gym by 3. If I don't have that workout the rest of my day is destined to just be shitty. It's just going to, because, that's what primes me. That's my time. And that's when I can actually work through things in my head. It's more so mental health than anything. Like, granted, the physical changes, that's just a byproduct. It's all mental health. But when you start the day off, or you, at some point during your day, you start taking your health in consideration, you go to the gym, you overcome that adversity that you placed onto yourself, you can overcome anything. So I'm a huge advocate with you, exactly, that it's the truest form of mental and physical health activity. You just gotta be it. So how does the health coaching work? Is that is it incorporated into the DPC, or?
So we offer our members a discount for the health coaching because it's a lot more intensive. We're meeting on a weekly basis instead of quarterly or just as needed basis with our patients. And we're diving into a lot more lifestyle stuff. We just add a little bit of an extra cost for the time spent. We do offer it to people not under our membership as well at a higher cost. But yeah, we do an intake, talk about your lifestyle, what your goals are, and really try to narrow in on how we can make lasting changes within your own routine to get you on the right track. And a lot of that has to do with starting with momentum and habits. Forming a habit and breaking habits can be quite hard. But if you've ever listened to Atomic Habits, he talks quite a bit on how to
James
do
Clear,
that.
dude.
So,
Beautiful book.
yep, it's amazing. I would recommend it to anyone. But exactly that, and then a lot of just support on the back end as well. How are things going? What can we change? What ideas do you have to improve your health and whatnot? And just addressing those underlying problems together instead of being like, "Hey, go be healthier, go move."
Yeah. Yep.
That can be harder said than or easier said than done. Yep.
But unless someone knows what that means, like, it doesn't mean anything, right? It's like, hey, you need to improve your lifestyle interventions. You need to eat healthy. You need to work out. That means nothing to someone that hasn't experienced it before. But with the health coaching, you're guiding them through this journey. You're showing them how to do this. And so I think that prevention is so much more important than actually having to treat something, right? Prevention is key. It's absolutely key. And one of the things I love about the DPC model is that's what it's really focused on. This is
Hmm.
focusing on preventing these issues before they happen. So you're not paying these astronomical hospital bills. Hopefully you never have to go to the hospital. That's the goal, is stay out of the hospital, stay out of the traditional health insurance hamster wheel. Now, this is something that I hear too. Some people will say, well, with the DPC, do I even need insurance? What are your thoughts on that?
So yeah, that's a little tricky, and I wish there was a better model for working in direct primary care. There are some health insurance brokers that can help do that, but I do still recommend everyone still has some type of either high deductible coverage or health share plan just in case something does happen. You never know when you're going to get in a car accident, break a leg, have a heart attack if you're a bit older, get cancer or something. And if anything like that happens, you're looking at least 40, $50,000
Easily.
down the drain. So having like a $7,000 deductible plan doesn't look that bad after knowing you're going to spend that much otherwise.
Right. Not to mention you get a health savings plan too with those high deductibles, most of them. So
Yes.
good deal.
And now in 2026, it's officially been approved to use that health savings plan for direct primary care. So you can pay your membership with that. So that's super cool.
Yeah, that is. You got to use that money that you're saving up. And, the reality is that's the way I've always viewed insurance. I've always, I've been pretty healthy. I was, for the most part, I would never went to the doctor, right? I've got better about it. I go to my annual exams or whatever. But the reality is, you know, if you're someone like me, the direct primary care is beautiful because you have direct access to your provider. You can talk to your provider about something and it's so easy. The threshold is almost non-existent. Do you guys do like a texting or an email? How do you guys communicate predominantly?
Yeah, we offer texting. I say operate 9 to 5. After 5 o'clock, I have a family. Certainly want to spend time with them and everything. But if it's after 5 o'clock and I'm not doing anything, and I get a text from a patient, I'll help them kind of triage it. Do we need to do this right now? Can we wait till tomorrow? But I do tell them our turnaround time is at most 24 hours. So if I don't get it to it that evening, we're hitting it first thing in the morning and addressing what needs to be addressed. So yeah, texting, calling, video chats, and then if something needs to happen in person, IV fluids, laceration repairs, anything like that, we'd come out to you.
Man, dude, that could not be more convenient. One of the things I hated the most about having to go to these annual exams was going all the way out there, right? A lot of this stuff doesn't need to be done. Like you're coming to them. That's huge. A lot of people I talk about will have like a telehealth practice, but very few do the mobile component. Now that's kind of more of a niche thing. Do you have a specific radius that you operate in?
Yeah, right now it's not too bad because our patient panel is quite low. Once we get a little bit higher, it's probably going to take a little bit more narrowing in on what that looks like.
Some logistics.
Maybe,
Yeah.
yes, exactly. Maybe only offering a couple mobile visits per day, and then the rest being telehealth, and could be pushed out a little bit. But right now, it's not a problem. We just kind of space our patients out, and given the model being so much lower of a patient panel that you have to that you get to work with anyways, it hasn't we haven't run into that problem yet.
Yeah. And so right now you operate strictly in Colorado. Do you have any plans to branch off into some other states?
I was actually reading about Eastern Colorado a little bit, and some of
Yeah.
those small towns out there are really struggling for primary care. They're either traveling really far, waiting several weeks to, months to get in. And I think offering virtual care to them would be huge. So I'd probably start by branching out that way. But yeah, I don't see any reason not to expand. And, if people find value in this, and we can do it via telehealth, and the better technology gets with the wearables, blood pressure cuffs, and our lab network, the easier it's going to be able to offer telehealth to lower population areas that really need
Right.
it.
Yeah, kind of like little medical deserts. I don't know if you're familiar with Eads, Colorado, but it's a small little town in eastern Colorado. And I did some clinical rotations out there, and I was out there for weeks at a time. And there was just one small little clinic that operated as the primary care clinic, also the emergency department. Small town, farming community, really underserved, right? They could really benefit from some telehealth stuff because a lot of those farmers don't want to come in. They're busy. They're working on their crops. Like they don't have the time, right? A lot of people think, yeah, you have to be rich to do a DPC. And that couldn't be further from the truth. This is for the everyday working guy. We're busy. We're all trying to just live. It's really easy to just carve out some time to just get a scheduled appointment in, right? Instead of having to take off work for a day, go all the way to a clinic. This is for everyone. This isn't just for the top echelon high performers. I mean, granted, they use it too, but this is something that a lot of people are going to realize this is the future. As much as people say it's not going to work, I've had so many people say it's not sustainable. Guess what? It is so sustainable. I've talked to so many providers on here who are thriving, and it just takes time. And it takes time, and it takes education, and it just takes awareness. And that's what we're doing today is we're kind of spreading that awareness. Now, as far as, in Colorado Springs, would you say that it's pretty competitive out there with this model?
I would, yeah, and I couldn't agree more with what you just said. I think it is the future, and Colorado Springs, along the actually entire Front Range, is one of the biggest early adopters of direct primary care. If you look across the Front Range, there's tons of clinics popping up, and I think people are starting to see the value. And one thing I would encourage people to do is, look at their overall health spend for the year, how much they're spending on copays, urgent care visits, which can rack up money real quick, and see if it makes sense that you pay a membership fee. We can take care of 80 to 90% of your healthcare needs with that membership. You have better access, more time with us, and no annoying phone trees or surprise bills in the mail, that kind of stuff. You're calling me directly. So I think the value's there. I do think it's the better way to practice medicine for us and for our patients. And I think it's going to grow.
There's no doubt. I mean, just maybe a couple months ago, I went to this fitness expo up in Northern Springs, and there were maybe like 10 or 11 DPC practices that were all getting up and running. Now, what do I think about that? Do I think it's getting diluted? Well, no, I don't think we'll ever get diluted because there's so many people that need health, right? And this
Yeah.
is something that I think a lot of people get caught up on is we're quick to say the competition is the guy down the road when the reality is that's not the competition. The competition is the false idea that people need insurance. If we all just band together and focus on bringing awareness that this even exists and the benefits of it, there's more than enough patients for everyone. The need is there. And oftentimes I'll have people say to me personally, because, in Pueblo, we have a couple different hormone clinics. People will say, well, hey, Jeremiah, are you worried about that clinic down the road?